Okay, let's get started. A warm hello to everyone joining us on Zoom today. It's 5 p.m. in Singapore on Wednesday, 28th October. On behalf of the SingHealth Duke-NUS Global Health Institute, I'm delighted to welcome all of you. This is part 2 of our 3-part webinar series on healthcare innovations in response to COVID-19. As some of you might know, our institute is focused on supporting and growing research, educational, and capacity building collaborations in the ASEAN region. We want to create opportunities to have productive knowledge exchanges and learn from each other. We want to make these exchanges systematic and strategic. And that's the rationale underlying this objective behind this webinar series, to highlight innovations that have been developed in Singapore and in the region, to understand some of the challenges faced in developing them, and to explore the potential to apply them in these different contexts. We feel there's a richness of innovation across the region, which we have tried to tap into so that we have a lively cross-directional exchange. And I very much look forward to the discussion today in this two-way and many multi-way discussion. I'd like to now introduce our moderator for today's session, which is Dr. Yasser Bhatti. Yasser is a senior lecturer in innovation and strategy at Queen Mary University of London School of Business and Management. He's also the director of the Masters in Entrepreneurship and Innovation. His work is focused on the study of emerging models of innovation and strategies which promote inclusive and sustainable growth across the global South and North. He's recognized as one of the leading experts on frugal innovation, an approach to problem solving that aims to do more with less for more people and for greater social impact. Transcending traditional disciplinary and sectoral boundaries, he merges an understanding of frugal, social, and reverse innovations with strategy concepts, mainly cost leadership, business models, and scenario planning. He also works at the intersection of management and health, relying on mixed methods research. Yasser completed his PhD in Innovation and Master of Science his PhD in Innovation and a Master of Science in Entrepreneurship from University of Oxford's Business School. Having worked in both the private sector as well as the multilateral development sector of the United Nations, he seeks to bridge the gap between the academic community and the business world. Bringing this wealth of experience, we're delighted to have him moderate this session, and I would like to thank him again for taking the time to be with us today. Before I hand over to him to present the panelists, I would just like to note that this webinar is being recorded, and please do post any questions you may have in the question and answer box, and they'll all be looked at in the panel discussion section. So over to you now, Yasser. I think you're on mute.
Right, yes. Thank you very much, Amina. Thank you to your whole team for organizing this webinar. In addition to my professional lens, thank you for that great overview of my professional accomplishments and my research. I also add another feather to the hat in terms of moderating this session. Unfortunately, last week I tested positive for COVID, which gave me a first-hand personal experience of the disease. And thankfully, I seem to have suffered only mild symptoms. I mention this only to share that the disease is very much alive and active all around us, particularly with this second wave now spreading throughout the United Kingdom and indeed elsewhere around the world. COVID may have restricted our freedom of movement, but it has accelerated our ingenuity. It has accelerated our collaborativeness and determination to continue to live and work. We have gained a renewed appreciation for communities and whole nations to come together in adopting new practices and processes, many of which we have long talked about, but certainly have delayed them for some reason or another. And this is the focus of our seminar today. So without further ado, let us hear about some of the fascinating innovations that have transpired from Singapore, from Malaysia, from Vietnam, from Laos. And the plan is to have each of the 4 speakers talk about 5 minutes each, thereabouts, followed by around 10 minutes of panel discussion and dialogue. And then we'll open it up for questions and interaction with the audience. So I will introduce the speakers one by one, followed by their presentation. We'll have Professor Wong Tien first, then followed by Dr. Fazila Alauddin, and then Mr. Tuan Don, and then finally we'll have Ms. Sirifon Sally from Laos. Right, so let me introduce the first speaker. Professor Wong Tien is currently Vice Dean of Academic and Clinical Development at Duke-NUS Medical School. He's also the Medical Director and Senior Consultant Ophthalmologist at the Singapore National Eye Center. He was previously Chair of the Department of Ophthalmology at NUS and Chair of the University of Melbourne in Australia. He completed his medical training at the National University of Singapore, NUS, and then obtained a Master's in Public Health and a PhD from Johns Hopkins University. Professor Wong has published over 1,300 peer-reviewed papers, and his H index of 148 is something that only I can dream of achieving in the management domain, which can be particularly hard. He was cited as the most, in 2018, he was the most highly cited researcher. So we have the pleasure of introducing Professor Wong for his thoughts on the innovations that have been developed as a result of COVID-19. Over to you, Tien. Thank you.
Thanks very much. Can I have the next slide? I have the pleasure of starting this discussion and I'll give a little bit of short thoughts on digital innovations in the post-COVID new normal that has been going on, not just in Singapore, but obviously around the world. Next slide, please. I think this pandemic shows that really we can't go back to business as usual in the healthcare sector. There's been a lot of disruption. Patients need care, but are unable to seek care because of this disruption, the lockdowns, as well as the changes in the work, as well as the work schedules of different people in the healthcare sector. And so digital technology, which is maturing in the last few years, offers a potential to disrupt this. Next slide, please. Now, what kind of digital technologies has been used in COVID-19? We recently did a systematic review where we looked at what has been published so far. Now, this doesn't represent everything that's going on because many countries are adopting and using digital technology, and they have not yet, of course, been able to publish their reports. But nevertheless, from this very short, quick review, out of about 1,904 records that we searched for, we included 247 that I will show you some results. And it's quite interesting. What we did cover are the following digital technologies. Obviously, AI or artificial intelligence, the use of big data, the use of Internet of Things, for example, devices that collect data and that are able to upload data into web services. Of course, a very big aspect will be telehealth, the use of telemedicine, video consults, phone consults. We also looked at 3 different digital platforms for communication, for example, not just websites, but other online discussion for dissemination of information, digital solutions for data management. Did people start using things like blockchain, as well as digital structural screening, essentially for things like novel therapeutics, drugs, and vaccines, right? So these are the spectrum of domains that we looked at. Next slide. We found, not surprisingly, the following. Most of the published papers arose from US, 84, which is, of course, still and remains the major, you can say, the major digital nation that's producing some of these technology. Unfortunately, you will also realize that they are undergoing significant disruption from their healthcare system because of the pandemic. So there's no correlation in one sense of how much you do on promoting digital technology in terms of that and the outcome of the digital technologies on the COVID pandemic, because US has been hit very badly. The second most important finding we found was that China has produced significant digital innovation, as you can see from there, which is number 2. And again, it fits in with what we know about digital technology. In contrast, digital technology does seem to have a significant impact on COVID-19. And you know that China has mostly managed COVID-19. And a lot of it has been due to their use of digital technology. So I think on one sense, you will see that some that has promoted it have not been able to handle it that well. And those that have also adopted it, like in China, has been able to manage it quite well. Next. We looked at a few of what the digital technologies were used for. And we divided into 2 things. One was clinical applications, were the digital technology helping for patient management, right? And one would be screening, diagnosis, for example, the use of AI to detect whether or not patients are positive or not, right? That would be a clinical application. Another part that was quite well used was continuing care on non-COVID patients. For example, the use of telemedicine for taking care of patients that could not come in. They don't have COVID, but they could not come in for their usual care. We also look at operation applications. For example, how was it communicated to the community and so forth. Next. And this chart shows you the strength of evidence as well as a translational relevance. In other words, the top right-hand corner, which shows Tele-Health, suggests that there's good evidence for both clinical and operational applications, as well as the studies to date shows good evidence that it is useful. However, although there are lots of reports on AI, it is in the lower left-hand corner, which suggests that the quality of the reports are not as robust, and therefore the application may not be so easy to adopt and so forth. Other things has not been actually quite well covered, essentially, and really offers opportunities for the future. Next. We also know, of course, that in the lay media, there's a lot of interest. So I think digital technology, including telehealth, suggests that, there's a lot of potential, not just for ASEAN, but for other countries. Next. There's also been some thoughts, and this is a group led in Duke-NUS, which looked at whether or not a lot of the global regulatory authorities are approving kind of new processes and digital technologies faster. And on the right-hand side, you see that there's been a lot of approval for video consult and phone consult for a variety of conditions in Singapore. Next. However, there remain significant barriers, and I think that I would like to share that although you can use a digital technology, the acceptability of the program, the support of professional bodies, the platforms fitting in with what we call the bricks and mortar of the old hospital systems. Some of these non-technical factors must be considered before digital technologies become useful and used widely. Next. So I think that summarizes a little bit of what we have seen in use of digital innovation for COVID-19. And I think that it's really a good opportunity for ASEAN and many countries to use it. Thank you.
Great. Thank you very much, Tien. I have a number of questions for Tien, but I will ask them after all of the speakers have presented. So next we have Dr. Fazila Alauddin. She has over 25 years of experience in the Ministry of Health of Malaysia, where she presently is the Senior Deputy Director of the Planning Division. She has held various leadership roles in Tele-Health Division, Planning Division, Medical Development Division, and at Selayang Hospital, which is Malaysia's first digital hospital. Fazila holds an MD from the National University of Malaysia and an MBA in Healthcare Administration from the University of Toledo in Ohio, USA. So Fazila, over to you for your presentation, please. Thank you.
Thank you. Thank you, Yasser. Can I have the first slide? Yes, a very good evening to everyone online. I will just give you an overall digital response on COVID-19. And this first slide you see is actually a tribute to all our frontliners, which is, it is multi-stakeholders. It's not only Ministry of Health, but it's also the police, the army, the civil society, and so forth. Next slide. Just a quick glance of where we are today in Malaysia. If you see on the far right, we are already hitting the third wave, and it's really hitting us hard. Where it's now we have 4 digits numbers daily, 3 to 4 digits. And as of yesterday, 5 p.m., we have 28,640 cases. So we have gone through 3 waves, and right now I think this is the toughest time we are having in Malaysia. Next slide. In an overall COVID-19 digital response, actually we had 6 focus areas. It's either in the area of strategic and risk communication, where you can see there are a lot of initiatives in there. In terms of community engagement, we have developed a new app called My Sejahtera, which I will explain in the next slide. There are contact tracing apps, social media channels for public information and live webinars. We also have e-appointments, virtual clinics, and virtual health advisory and chatbot. So a lot of community engagement is done during this COVID time. Like as mentioned by Prof. Tien earlier, there are also systems to improve operational efficiencies. We have developed some data collection system called eCovid, and also demand and capacity planning systems for the hospital. But some of the existing systems like the National Public Health Lab systems, the e-notifications, and facility-based systems will continue to be used. There are also analytics, dashboards, GIS that's been used more for insights and foresights. We had a lot of infrastructure upgrade, which amazingly we were able to do in weeks, which never happened before. Like improving connectivity, video conferencing tools. We are also doing our 5G trials in the country, so we are using the 5G fixed wireless access and portable base. But this also will not be possible without the telco's support. Research and clinical trials in the area of digital health will include big data, AI for CT scan and X-ray, molecular modeling, 3D printing for PPEs was I would say was very extensive during the pandemic. Robotics were used in some of the areas, and also some dashboards. So our strategy is either we have a new system, a new initiative and system development, or we just leverage on whatever existing platform that is and modify to meet the COVID requirement. Next slide. So if I put it in a picture format, this is the entire picture of all the systems. I've sort of tied it all together, and where it is integrated and where it is standalone. But I think what's important is there are systems to address community needs. There are systems to address the operational needs. There are also systems to address the tactical and strategic needs. But everything must be supported by infrastructure. So the earlier slide shows the focus area, but this one shows how it is put together. And some of it we have started integration, and some of the link points are also work in progress. And if you see for strategic and risk communication, the entire fleet of social media has been used along with the online mass media for public information and also public engagement. So basically, this is the entire digital forward approach. Next slide. A quick one on this My Sejahtera app. My Sejahtera means Sejahtera is like happiness and contentment. So it is more for enhancing community help through mobile application, and this was created for COVID-19. And as of 24th of October, there's 22.43 million registered. Our population is about 32 million. So it has various functions, but what I want to show here, it is actually a strategic cooperation among multi-agencies. The National Disaster, the Cybersecurity, the Prime Minister's Department, and of course the main tenant is Ministry of Health. It has various functions, 8 modules, and some of it is, for example, health assessment categories, business check-ins for travel, complaints, and so forth. It also has a hotspot tracker. So this is one of the main app that has been used during the pandemic. Next. But what I think is important in the digital response is not only the solution, it is the multi-stakeholder approach. So the picture that you saw earlier where I have put everything, all the solutions, but these are the players behind the scene, inter-agencies, inter-ministries, and also industry support. There are many agencies and universities that's involved. Industry, you can see all these are the players that were involved in this entire, I would call it this entire digital symphony of COVID-19. And in terms of infra and network, these are some of the major players. This is non-exhaustive. So a multi-stakeholder approach, a whole of government, whole of society approach, I think is very important in addressing this pandemic. Next slide. So in moving forward, there are a few strategies we are looking at and we are further improvising. We have to continue to strengthen the preparedness and response capacity, the public health intervention, and so forth. We must also continue to strengthen health system and health workforce capability. And of course, enhancing digital technology, data, and analytics is very important. And actually, the pandemic has further strengthened that this is really needed. Investment in technology, investment in research and in innovation. And moving forward, we have a huge impact on the economic. So we need to revitalize the economy. I think we really need to redesign the healthcare. This COVID has actually exposed a lot of weaknesses and limitation in healthcare. And of course, enhancing multi-sectoral coordination is very important. Without industry collaborations and support, this is almost impossible. And public-private partnership between ministry, academia, university, and the private sector. And of course, the civil society and the people as a whole. And I think we also need to further strengthen regional and international cooperation. This pandemic is hitting the world, it's global level, regional level, and I think this is where we need a lot of cooperation, not only in digital health and innovation, in many other areas, including vaccine, treatment protocols, and so forth. So with that, this is my last slide. It just gives you an overall on the digital response for Malaysia during the pandemic. Thank you.
Excellent. Thank you very much, Fazila, for those insights from Malaysia. We have next Mr. Tien Don. He is currently Chief Strategy Officer at Bot Ban Hang, a chatbot platform company based in Vietnam. Prior to joining Bot Ban Hang, Mr. Tien spent 3 years in Germany where he achieved his master's degree in management and worked in risk management department, taking care of private equity and debt investments in Europe and the USA for Alliance Real Estate, which is the leading real estate investor in the world. The international working experiences he gained there have helped him to expand the Bot Ban Hang business globally. So Tien, we look very much forward to hearing about your innovation, your app.
Thank you, Yasser. So this is our one of the applications for in response to the COVID-19 situation. So how we came up with this idea, because at that time there are so many sites or channels that talk about the COVID, and not many people can access to that, and also there are so many fake news at that time. So it can create the panics for the population. So in seeing those problems, we see that why don't we create some application to help the people to reach and to get the trustworthy sources about the information of the COVID-19 and how they should do on to protect themselves from the pandemic. And that's why we create this chatbot platform. And next slide, please. So what the chatbot platform we do is an automated platform, and which help the people, the user, to reach to the information about the COVID-19 from trustworthy sources. And we have the statistic about COVID-19, the global situation about the COVID-19, and the advice for the people who advice for people that what they should do to protect themselves from the virus, and also any updated information from the newspaper. Next slide, please. So this is one of the application. As you can see, people can see the advice, can choose to get the information, and also get and share to other people to for them to know more about the situation and protect themselves. So in the future, what we are going to do is we will create the AI based on the user data, and we analyze that, and we can create the early warning system for the user when they use the chatbot platform, and when they go to any location that can have the potential of virus pandemic, and so when they go and meet any people that might get exposed to people that got the virus, then it can create the early warning system. So that is the moving forward for our product, and that is for our application. And yeah, thank you.
Excellent. Thank you very much, Tuan, for those insights from your company and your app. Next, we have Ms. Sirifon Sally, who joined the United Nations UNFPA. Sorry if I don't know the full nomenclature for that. Sally joined UNFPA country office in Laos PDR as a sexual and reproductive health program coordinator in September 2013. Before rejoining the UNFPA as a fixed-term staff, Sally worked with international NGOs as well as UNFPA under the Regional Adolescent Health Program from 2001 to 2005. She is a qualified registered general nurse from Brent and Harrow School of Nursing in the UK. She has a certificate in teaching and assessing in clinical practice, as well as a certificate in tropical medicine. Her bachelor's degree was in life sciences from East London University, and she has a master's in development management with a focus on population and international health from the University of Wales. So, Sally, over to you. Very much looking forward to hearing about your insights.
Hi, hello everyone. Thank you, Yasser. In fact, what I will be talking about would be, trying to actually use high tech in a low tech kind of setting. So let's see how that goes. Next slide then, please. So, as you know, Laos was actually among one of the last countries globally to report on the confirmed COVID cases. In fact, it wasn't until April that 2 patients actually tested positive. And since then, we have only the total of 24, which is a good thing. And all the confirmed cases were isolated in designated hospital, had case investigations done and contact tracing done. The preparedness and response activity coordinated through the Ministry of Health, but with all the efforts at the time going towards responding to the disease, routine services were then being left behind. You can see on the graph that that some of the routine data, service data, you can see that in the first quarter of the year, in comparison to other years, previous years, that the coverage had dropped. Even though in the past 11 years, significant gains have been made in Laos on the RMN-CAH, which is sexual and reproductive, maternal, newborn, child and adolescent health programs. So with these drops, we were on a high alert on how to maintain these services and make sure that patient can still access care despite the ongoing fear of contacting COVID, and not only from the patient side, but also the staff side as well. So next slide then. So in order to try to maintain these essential services, we had to rethink of how it could be delivered so that you can actually allay fears on both sides. And in a timely manner, a regional guideline was developed jointly by UNFPA, which is a United Nation Population Fund, actually. It used to be Fund for Population Assistance, but we just call it Population Fund. UNICEF and WHO, and it was launched in the region around May time, which greatly helped the Lao country office to look at it and see if we could adapt and adopt some of the measures that were suggested to try and maintain these essential services. So basically, the guideline focused on 3 key options. The first one is focusing on making the facility safe for the patient clients so that they can access. And some of it, the suggestion was to have task shifting. So basically having less staff doing more that can cover the major areas of work. So that in that way, limiting the number of contacts. And the second option was to, if the community can't come to facilities, then take the services to the community. So that would be increasing the mobile outreach care, but that was not always possible. And the last option was to try and use this telehealth mechanism to both, use it for the training of staff as well as providing service. So using it to ensure that these essential services are being taken up. So next slide. So in order to establish the mechanism, there were a number of considerations to be made. Obviously, you don't want the routine care or the specific guideline for patient care to suffer. So the particular guide or design of the guide had to actually take into account all these quality care that had already been developed. So how could these quality be maintained? So if the telephone or video conference would be used, how we would still make sure that providers can still assess their patient correctly in terms of their status. If we're looking at ANC, are we certain that that pregnant lady is still getting the best care that they need? The second thing was to look at how do we maintain record of the patient care, because basically in Laos there is the record book is actually kept with the pregnant women, so they are given a pink book as soon as they start coming to antenatal clinic, and that pink book they bring every single time they come to access care. But then if the providers were to use the telephone or video conferencing, how do then keep all these records in the right place so that it can be attached to the patient record once they come back. So all of these things had to be designed into the new guideline or the adapted guideline. And of course, we have to also consider the technology on the patient side as well. So it's not just, not everybody in Laos has a phone or has some sort of device that can be connected. So some of these things, if we were to actually try or use telehealth, the providers may be able to have their phone, but then if you can't contact the community, patients in the community, then all of these things would just not work. So all of these had to be included in the consideration in developing the guideline. Do I have another slide? And the last one, when we go into the actual implementation or application of this telehealth, obviously the link between the facility and community has to be very strong. This guideline that we had developed, we were trying to test it in three districts of Luang Prabang province, where they had actually 3 COVID positive cases. So when we did the baseline of before designing the guideline, in talking to providers, they were really scared because they didn't know, who had the disease and who didn't. How do you actually screen? Do people actually present, without, they could actually be presenting without any symptoms. So there was fear on both sides. So the link with the community, it's really important that you have a good mapping of each village, whether they have, what number of pregnant women do they have, what postpartum women, are living there, children under 1, under 5, adolescent groups that would need possibly, family planning service, and all of these things had to actually be mapped out before a provider at a health center level could then start looking at, which service they could actually use the telemedicine or the telehealth mechanism. And as I said, the device or phone, internet, have to be arranged. Not everyone has a phone, as I said. So all the different technology that would require for this mechanism to be started and set up had to be taken into consideration and set up. There's not a lot of infrastructures. Even using the phones in some villages, you don't get signal, easily. Some of them might have to actually climb up to a very tall tree to actually get a phone signal. So, to try and then, talk to patient through their health assessment, it's not an easy task. So far we have trained health providers at health center levels on this new guideline. We've done the mapping, and now we're now going to be monitoring how it is implemented. And there is already plans for us to actually make an assessment maybe early next year to see how effective these care through these telephone counseling or video conferencing work, and whether it works well. So some of these things is still like work in progress for the Laos country office, and we will actually document the whole process and learn from it. But already in the discussion with the providers at the local level, these are the kinds of things that they would really welcome, simply because even if there is no COVID, there is seasonal flooding, a small disaster that would prevent women from accessing care. And this would be a really good way of making sure that women in the community can still maintain still have the essential services. So I think that's all I have. Yeah.
Great, thank you very much, Sally. Thank you for those insights. I'm going to ask questions that came to my mind, as well as I'm going to ask you questions from the Q&A chat box we have functionality. So let me work my way backwards. So in terms of recollection of the presenters, I'll work backwards. So Sally, do you think that the COVID has accelerated what was already planned by your UNFPA, the United Nations Population Fund, or has it derailed the original plans?
In fact, it's the opposite. It's actually delayed some of the planned work that we had wanted to implement. Obviously, we have an annual work plan with our partners, Ministry of Health, and with COVID, when COVID came, all efforts, all eyes went onto the response, making sure that the immediate issue is dealt with. So everything else was put on the back hold. So in fact, it has delayed, and once the strict lockdowns were lifted in May, mid-May-ish, then everybody was trying to catch up and trying to implement, what had been planned. But of course, a lot of the funding was diverted to the COVID response. So from the government side, it was not an easy task to try and implement planned activities.
Okay, thank you. And there is a question for you, Sally, from one of the audience participants. Are the COVID, it's somebody anonymous, so I don't know who is asking the question, but are the COVID cases in Laos mainly imported cases? Are the numbers low due to low returns, or somehow even those who have returned have not been exposed somehow?
Yes, they're all imported cases. The first three that was actually identified, as I said, in Luang Prabang province, because of it being a touristy place, was actually with the tour guide who had, Korean tourists, and she was taking around. So, and as soon as, everyone else around Laos was getting cases, Laos started to actually close borders. There had been returnees from Thailand, from Vietnam and other countries. And as soon as they come back, they are in quarantine, they're locked up, they monitored closely, so that, in fact, only 2 cases actually was identified in those returnees. So yes, these are all imported cases, and because the country has been so strict in locking the country, that I think it's very fortunate that we don't have any more cases.
Great, thank you very much, Sally. Over to you, Tien. I have a question that's related to a question that's been posed by an audience member. Do you solicit information from the user, or is this like a one-way communication in your chat box? So do you, for instance, also solicit data from the user in terms of how, what they feel like, what symptoms they're showing? Is it used for track and trace? Yes, and so on top of that, a Mr. Sufi Suhail has asked, is there any digital technology to monitor prognosis of cured COVID cases in view of monitoring symptoms for long COVID?
Okay, for me first. So actually, our chatbot platform is not one-way communication, but it could be, I think, two-way communication. So our system, we give the information for the user. They can get the information from the trustworthy sources and the advice from the trustworthy sources like WHO. And the other way is that the user, we connect with the Ministry of Health, so the user can put their data in, the track record, the health declaration, the traveling, and then in return we give them the feedback on the risk that they can, the risk of the COVID exposure, where they go, and also the the people that they meet, do they have any risk of COVID exposure? So that would be the true way, and we work closely with the Ministry of Health, and we have them to analyze data and also give the feedback for the users. So there will be two ways of the communications.
So that's planned in the development of your app for
for the two ways is already, but for the plan in the future is the AI one. So AI one means that we can analyze the data and also give the early warning. Right now, people can send the data, user data to the third party via our chatbot platform. We think our platform as a one-stop platform or the gateway to get to the Ministry of Health or the hospital, and via those information that's give to us, we can from the Ministry of Health or hospital, we can give them the feedback and what they should do and what they can do. So right now it's currently work, and in the future we want to do the AI one to help people to predict to give them the early warning where they gonna be or they gonna face the potential of COVID exposure.
And there's another question for you, Tien, from Wilson Can. How is the entire chatbot ecosystem funded? Is your company for-profit or non-profit?
Our company is for profit, but not for, but is non-profit for this health platform, because we actually our company have online business, but for this project we do for non-profit, and we just see the pandemic and it create a lot of panic and for people, and we just think that we should do something that can contribute to the society. So this one we do for non-profit.
Great. Okay. Thank you very much, Tien. Next, Fazila. So my question to you, which I have in mind, is how closely are aligned are ASEAN countries in terms of infrastructure development and regulatory frameworks to make the innovations that are developed in each country to be adopted and diffused across the region?
Actually, in ASEAN, there are three main pillars. One is the political security pillar, and then we have the economic pillar, and also the social cultural community pillar. And the ASEAN health cooperation, it is in the social cultural pillar. But a lot of the focus over the years has been on challenges, accessibility, food safety, and so forth. Only in 2019, October, we all member states got together to do a new technical working group called the eHealth Technical Working Group. And it was just approved like a few weeks ago. So our first meeting is only in November. But in Malaysia, we have suggested that we want a regional policy, common policies to advance digital health, to advance innovation. And also we are looking at collaborative ecosystems in ASEAN. So this is still very new. So I'm really looking forward for the November meeting to see how we can work together in digital health and innovation.
Great, thank you, Fazila. And two questions for you from the audience. One, how is Malaysia using data science methodology to optimize the data gathered in MySejahtera? Or is it just used for contact tracing?
Okay, actually MySejahtera, we actually started with a very simple CSR project where we wanted to have a community be empowered to monitor the outbreak, to assess their risk category of individuals and families, to get all the guidelines and information. That's how we started in late February and March. But slowly, then only it went into contact tracing, and today it already has 8 modules. So it has evolved very fast, And but we do some analysis other than surveillance, mapping. But moving forward, I think we are also looking into prediction, and we have to bring my Sejahtera to the next level of analysis. And it is still evolving. And with the base of 22 million people registered, we are also looking into repurposing this post-pandemic. So there's a lot of work still in progress, still that's being worked out, and more enhancement is being done now to include other things. Yeah.
So did you say that 22 million people are registered on the app?
Yeah, correct. Because it's mandatory for check-ins, so for premises and businesses. So more and more people are registering, and also it is tied up with financial stimulus package. So so it's so yeah, that's how it is.
To give you a comparison perspective, I think the population of Malaysia is around 31 million. So that's almost 2/3 of the population, which is amazing.
Yeah.
And the most popular app that I'm using here in the UK is called the C19 app, which was developed by King's College.
Yes.
I don't know if you guys can see that. But this app I'm using to also report my symptoms on a daily basis.
Yeah.
And there are 4.3 million contributors on this app.
Okay.
Which is a fraction of what you have on your app.
Yeah. But our concern right now is how to have a sustainable business model, and how much of this can we sustain when the pandemic is sort of slowed down or it's over. Hopefully it'll be over soon. Yeah. So
on that point, Fazila, the next question for you is from an anonymous participant. Why is Malaysia experiencing its worst wave now? What were the failures in public health measures?
Actually, it's not a failure in, I would not put it as a failure in public health measures, because I think we have further strengthened our public health intervention. But there are few things that has happened during this time, which one is a election, a state election, a statewide election, which is now which has the highest number today, and it has also caused a community outbreak, the entire state. There are also prison clusters and foreign workers clusters, mainly due to, of course, living conditions, crowded and confined area, and also I think complacency in following SOPs. So this has really hit us hard this time. But the public health intervention is being strengthened, and we are still continuing our active case detection and contact tracing. Yeah.
Great, thank you very much, Fazila. Tien, sorry for bringing you last, even though you presented first. But the question I have for you is, as an academic, you and I both have, our universities have hopped on to blended models of education almost basically over a fortnight, over a couple of weeks. And we've had this in our strategic plans for years and years. Has the same thing happened in healthcare? And do you think that this is here to stay?
Okay, thank you for that question. Let me just say that the pandemic really hastened the adoption of digital technology for everyone. I would say that if we were to organize a webinar like this last year and say that, the speakers will just dial in and hopefully you have participants, you will not have your 200 participants or 300 participants there, because people will say, what does it mean? How do I have to log in? How do I, is it going to be do I need good internet connection? Am I going to hear the speakers and so forth, right? Now we know that we are able to organize what is essentially an international meeting without the need for travel and with fairly good ideas and discussion topics over an hour, which doesn't really require, a month or 6 months of planning and lots of money funding it, essentially. So I think the education industry, number one, has definitely changed. Now, it's going to be hard to see how some of the older models where you need to fly in speakers on business class and so forth is going to be sustained. I'm not sure it will ever happen again because this model works. In the healthcare, similarly, I think people are now used to a few things. Number one, they're used to the fact that maybe they don't need to physically go to the hospital and see a doctor. In many disciplines now, they would appreciate the ability for some kind of video consult that is now possible because they're used to it. The problem we have in healthcare is how do you use those kind of consults properly within a framework so that it delivers the care, follows the guidelines, and then there are other parts of the care that needs to be digitized. For example, how do you deliver the medicine without them getting it? Of course, you can't have surgery and so forth, essentially, right? So there are some parts of it is very prone to telemedicine and digital innovation in healthcare. But there are other parts that are still clunky and it needs to be, the entire process needs to be smooth, like what the education is doing. So the education enterprise, I think, will evolve much quicker. Many universities are going to go full online, and you can see that. Healthcare, there's still a lot of face-to-face physical infrastructure that we need to tackle.
And a question for you from one of the participants, Mr. Wilson Tan, is asking, for the systematic review on health technologies, were non-English articles included?
Okay, so I would say that we did a quick scoping review. We did not include non-English articles. Partly we wanted to have a very quick assessment. Everyone's talking about digital innovation. What is it out in the literature, right? And we did it only for the first 6 months of the COVID pandemic. I think when we start doing this review in 2 years' time, we obviously will have to do non-English language review because there will be lots of these reviews out of the English language. We know innovations occur everywhere. Nevertheless, what it has shown, as I've shown in the slides, is that maybe only telemedicine out of all the so-called digital technology has been used effectively, or at least has started to be used. Even the AI, which was so much promise, has not had very rigorous assessment, and certainly it's not been published at all. So we await very good reports of these in the literature in the future so that people can learn what is the way in which we can use it to tackle the current and future pandemics.
Great, and a related question to that is, foreign workers in ASEAN, mainly in Malaysia, Singapore, Thailand, are a big community to be addressed. The major barriers are language and an undocumented population. What are the panelists thinking about how their needs can be addressed?
Maybe I'll start first and then I'll ask maybe Fazila can also chip in from Malaysia perspective. For Singapore, as everyone is aware, the biggest problem that we had in the last few months was our foreign migrant worker dormitories, where there was outbreaks after outbreaks. And Singapore had one of the worst case numbers, right? They were going to thousands a day because of the same situation that even Singapore, when we thought that we had the regulatory kind of robustness of having checks and balances, but even then, the migrant workers were living in conditions that was really, allowed the COVID pandemic to spread. We found that the communication to them was quite poor, and therefore we have developed multilingual apps, and some of them we are now able to communicate them through very standard platforms such as Telegram, where they really like, and we use it. We had to develop multiple languages because we have migrant workers from multiple countries in the region. So 1, 2, 3 languages was not sufficient. It had to be in the 15, 20 range essentially. And I think that has helped now quieten down the migrant worker anxiety, and they're getting much better, clearer information and less fake news. So that I think that has been important in controlling that migrant worker outbreak that we have had.
Can I add to that? I think in Malaysia it's the same, but we have not really been successful in that. We have multilingual, and we use also NGOs to help us to translate videos of the guidelines and SOPs and also posters. Like Singapore, we had a lot of clusters with migrant workers. But I think what's important is to improve their living conditions. So that is also one of the areas that's being looked at. And there are also a few innovation digital platform which is done for migrant workers, which I've seen one of it, which is very good for the Bangladeshis. And I think that's very important to have digital platform where they can connect with their own doctors or someone in their home country with the same background and language. So maybe these are the type of innovations I think we have to start looking at moving forward. Thank you.
Great. Thank you very much, Fazila and Tien, Sally and Tuan. With that ending note on which innovations we should be looking forward to, we've got a lot more work on hand to continue doing. And for a bright future, we hope that we can share all our experiences across the region and indeed the rest of the world, where I am currently in the UK. There's a lot the UK, I'm sure, can learn from Singapore and Malaysia and Laos and Vietnam as well. So there's a few more questions, but we are over time now. And over to Amina for closing remarks. Thank you, everybody.
Well, I don't have much closing remarks except to say a big thank you to all the panelists and of course to our moderator who, as he mentioned, has himself, been kind of not in the best of health, but luckily it hasn't hit him too badly. So thank you all very much. I'll just make one comment which really struck me throughout every presentation and the entire panel discussion of how much we were in the present continuous. So it's all very much happening as we speak. And that's really quite remarkable. Usually, again, this new modality allows us to do that. Usually when in the old days, we'd have a presentation, someone would come and talk about what they did a year ago, or 6 months ago, things, whereas we are all talking about what we're doing today and what we're going to do tomorrow and what we still have to do. So I really kind of feel energized by that, presentness of it all. So with that, I hope we all keep in touch and kind of, make sure that we keep informed of each of our individual journeys in this such interesting times. So thank you all very much. Thank you to the audience. Please look out for our next webinar, which is at the same time next Wednesday. It'll focus a little bit more on some of the research around vaccines and drugs. We are having a very interesting speaker who will talk about AI in the applied to drug development for COVID-19. So I'm looking forward to that, and I look forward to having all of you in the audience and meet again soon. Thank you.
Thank you all.
Thank you so much.
Thank you.
Thank you.
Thank you.